Okay, welcome guys. This is another episode being hosted by Motivate OTs. My name is Tongai Chichaya. I'm a lecturer in occupational therapy based in the UK. And we are currently running a series of talks on different topics that we have been given by students and lecturers from the University of Zimbabwe. So today I'm very much honored to be joined by a very experienced occupational therapist. His name is Moffat Makomo. We often call him Prof because of his wit and his wisdom. Moffat is a pediatric occupational therapist, and today we're going to be talking about OT in peds. So join us. Hopefully, you're going to benefit from this discussion and this setting. Welcome, Prof, to this talk. If you may, please just introduce yourself and maybe some of the setting that you're working in, or some of the pediatric settings that you've worked in. I know it's OT for many, many years, so it's really a pleasure to have you.
Thank you, Dr. Chichaya.
Just call me Tongai.
I don't know, my name is Moffat Makomo. I've been in occupational therapies for a few years now. Initially, I worked at St. Giles Medical Rehabilitation Center in 2004. And there I initially started working with the adults. Then it so happened that the occupational therapist who was working with the children was on vacation, so we needed someone to cover for that department. And I hesitantly covered for that occupational therapist. And after working for 2 or so weeks, I really enjoyed my time there. So that was the beginning of my journey as in pediatric OT. So after leaving St. Giles in 2008, in around March of 2009, I went to Egypt, Cairo, and there I was the supervisor occupational therapist for a children's services, which focused on children mainly with ASD or autism spectrum disorder. At that time, there were only 5 occupational therapists in Egypt, like the whole of Egypt. And in Cairo, there were 3 occupational therapists. And at our center, there were 2 occupational therapists.
So the majority of OTs in Egypt.
Exactly. And it meant we were working 6 days a week because of huge caseloads. After leaving Egypt, I then went to Bermuda end of 2009, where I worked initially in the learning disability services. Then I moved to we call it CAM services, for child and adolescent mental health services, which is children below the age of 18, of which I worked in that CAM service up to last year, December. So starting this year, I'm actually working in Manchester at Trafford Children Therapy Services, where I mainly focus on sensory processing. So I'm the sensory processing OT here in Trafford.
That's great. I mean, it's a pleasure to hear that you've got all this experience. You know, I never knew that this was happening in your life over the years, ever since we parted ways in 2004 from the University of Zimbabwe.